At Andiamo, we're giving families their lives back by bringing healthcare out of the dark ages. This is my son Diamo, who was born severely disabled due to medical negligence. He needed a lot of care and support, but a lot of the fights that we had to deal with was because he needed support for his posture. Orthoses like these, back braces, hand splints, are used to help you and aid you for support. People with stroke, diabetes, and cerebral palsy use it. Without them, they find it very difficult with mobility. However, assessing and prescribing and manufacturing these devices are slow, inaccurate, and traumatic. It takes 6 months for this to come back, and by that time, the child has outgrown it even before they've got it. And then they have to do the whole process all over again. This is a 100 million person problem globally. Here in the UK, there are 2.2 million people who go through the orthotic services per year, and we have only 300 clinicians who are left serving them. That number is declining while the demand is going up. We needed to have a radical approach in solving this problem globally, and we've achieved this. At Andiamo, our technology combines clinical data with digital body analysis to guide the clinician in making better decisions, revolutionizing the design and delivery and manufacturing of medical devices. This enables them to have evidence-based prescription. The cost of the treatment is reduced by 50%. The wait time we have reduced from 6 months down to 1 week. And because we have And because we gathered the data and we see the differences, we are able to make positive outcomes to the children that we serve. Children like Kaisa, who practicing her walk using our orthosis in Norway. We also provide a huge savings across the value chain. So for the clinicians, they're able to give you a good service. For the children, when the orthosis actually fits, it means that they're wearing it. And because they're wearing it, it means the need for them to have surgery, corrective surgery, is reduced. That means the hospitals save costs on unneeded surgical procedures. This is a boy called Umar, who we saw last year. Umar is a 12-year-old boy. He's got cerebral palsy due to medical negligence. When we met Umar for the first time, he cried because he was so scared that we were going to give him something that will hurt him, exactly like his old orthosis. By the time we provided him with an orthosis and he did his first walk, he was so happy and said to his mum, "Throw the old ones in the bin." His mum asked him, "How do you rate the Andiamo orthosis? Give me 1 to 10. And he said, 100. We are ready to scale. We have the right approach, we have a disruptive business model, and an awesome team. And Diamo is a completely unreasonable company that will change this, that will take this problem head on and solve it to make sure that nobody in the world, no family, would go through what we went through. So come on, Andiamo.